All right, yeah, so, as I mentioned over email, Cammie cannot make it to our meeting today, but hopefully we can discuss, how we might make sure she's included in our, final recommendation process.
And she can watch this, so.
Yeah,
Hi, asynchronously, Candy.
yeah, she can watch this. Okay, yeah, so, I was hoping that in our meeting today, and are we gonna meet till 5:30? Well, when are we?
Yeah. That's what we planned, or that's what it
Okay.
says online.
Okay, and then I was hoping we could, share top level themes of our outreach to discuss, how these either confirm or contrast our initial research, what was surprising, how's Bloomington unique. 3, do the housekeeping timelines process, who does what, how can we include Cammie? Anything else we should talk about today in this meeting?
Sounds
That's-
good.
Cool. All right, let's get started. So yeah, let's share the top level themes we found in our outreach, and I mean, that includes you too, Liz, since you were at our outreach event. And especially with the breakout sessions that CJM facilitated, like what were the top level themes that we found? And specifically, what are the surface problems and the surface perceptions and problems? And then what are the underlying causes and problems or systemic structural challenges that we found? I have like a long list. So let's start with surface problems, surface problems, perceptions.
Yeah. Well, so a lot of people that I reached out to, and even at the event, it sounded like they were talking about service problems. They were talking about marginalization, right? And like lack of transparency.
Like lack of transparency in what particularly?
In how things are operating. Mostly that. So when and especially like a division between like things that are being promised and what's actually being done.
I saw a lot in the outreach, especially the outreach I did with city officials. This was very and with business community, really across the board. That the surface problems and perceptions of public safety problems revolve around people with mental illness, people suffering homelessness, and drug use particularly, like these 3 problems / perceptions. I mean, I don't think they're just perceptions, but this is also how public safety problems are perceived. Particularly, I found the business community, and a decent, I would say, at least half, if not more, of the city officials feel that marginalized people in these categories, mentally ill, homeless, and drug users, that they perceive them as safety threats to others in the community, and or that they discourage business or somehow reduce the perceptions of safety in our community. And that marginalized people themselves, when I did outreach with them, I found that in general, they are afraid to ask for help, or they feel like there is nowhere to get help for their needs. those are like the surface problems and perceptions.
That reminds me, there was, a lot of people called for either calling for resources or the ability to navigate that, and so, which kind of affirmed Cammy's inclination.
Mhm.
But like also not knowing how to address things. Another service one that I've heard from political stakeholders, and, advocacy stakeholders was concerns about, divisiveness.
Mm.
And sometimes in the same meeting, there would be the response to either clarification or later questions. Not being, saying that's not our function, right? So, and people admitted that we need more collaboration, but then at the same time would say, but that we can't bring that to the table.
As far as resolving these problems, that it's not their organization's
Right,
function.
so they're not, and even if it's not their function, they don't know how the collaboration would actually
Mhm.
happen.
Yeah, I also heard a lot of operational stakeholders, like city stakeholders, also say that collaboration is needed, especially with like different levels of government, like county and state, and federal. But it didn't seem the thought had developed beyond, well, solving homelessness requires the county and federal and state, and so therefore, don't blame us. It seemed like it hadn't developed past that very much.
Yeah. And so something that I was recently going back and reviewing a city council meeting, and they talked about the distinction they were trying to decide on wording between coordination and collaboration.
Mm.
And I think that a lot of times when people say collaborate, which means to labor, to work together, they really mean coordinate. So to say, we're not coordinating
Right.
this, the advocacy groups are coordinating it. But the need is really about each person working in their own function, but then
Exactly,
together.
exactly. Yeah, you're right. I think that word collaboration is used a lot when coordination is what's missing
Yeah,
in resolving these systemically.
or the other way around.
Mhm.
So they're using collaboration when they need coordination,
Mhm.
but they're not ready to participate in their labor.
Mhm. Liz, did you have anything to add as far as like surface problems and perceptions of public safety?
Well, I think a lot that the parts of the community forum or town hall that you all sponsored and that we helped to facilitate, did hear lots of folks feeling as if the issues around homelessness, drug addiction, and mental health seem to be increasing, and that there was some lack of information and understanding of what to do about it as an individual. And so I think that point that Jason just made about, people maybe not truly working together as effectively to solve issues seem to be, commented by on a lot of folks. And just sort of feeling as if, I think the other thing that was interesting is there were just a lot of folks that were very interested in the topic. And while they may not have had personal experiences of feeling unsafe, they were aware of either through their work or friends who, people that they knew. So they were able to identify challenges that our community is facing. So.
And I think the perception that these problems are increasing is, it's to me, that's indicative of underlying structural causes that are not being addressed in a coordinated way. Right? I mean, the problem's increasing. It's the underlying structural causes, it's not the reaction to them
Yeah,
that needs to be addressed.
it's not that more people are showing up, more people are participating without the underlying structure, right?
Mhm.
So it's like the problem goes deeper than the symptoms.
Mhm. And then as far as underlying problems and causes, so we kind of already started to move to that. So it seemed this is based on outreach and based on research. That I know some of the underlying problems are austerity policies, where that defund these needs, including access to healthcare, right? Drug use and mental illness are both really symptoms of a lack of appropriate healthcare. And then, of course, homelessness is a symptom of not having your housing needs met. And I know these are economic policies, really, truly, that protect, market and market power over human needs. So it's literally protecting markets over the needs of humans. And this, leads to a growing number of socioeconomically marginalized people, which we see in our local community. And then I saw a book called Nonprofit Neighborhoods, and it was talking about how these austerity policies at the federal and state level create problems that are just left to cities to deal with. And then the cities have responded by kind of outsourcing the problem solving to private actors who are not mostly nonprofits. And yeah, while they are nonprofits, they're also private organizations who have different incentives and different accountability structures, right? So a private nonprofit, I'm sure there's the people working in them may have wonderful intentions and motivations and be wonderfully brilliant and moral people, but they don't necessarily have the structural resources and or structural incentives to resolve these problems. So they're problems that, are created at like different levels, and then we've got this other level, because nonprofits famously aren't allowed to have like overhead and capacity, because they're constantly, being put on lists for having too much overhead and basically being named and shamed if they have any kind of overhead, right? There's all these lists about don't donate to these nonprofits because they have so much overhead costs and things. And they also, nonprofits don't have a long-term funding mechanism. Most of them are reliant on either like their own local fundraising or grants, and grants are temporary, it's only a temporary funding mechanism, and therefore the plans and strategies that go with those funding mechanisms are temporary, or if not temporary, much more short-term than the approach that a city government could have.
And superficial. So like one of the things that people talked about was like needing resources to address these problems. But what I hear you speaking to is like these problems arise from the systems. So rather than address the symptoms that are arising because we have structural problems, it would be attempting to redoing the structure to stop the problems from arising.
And of course, we're going to be limited in what we can suggest as the tax commission in providing structural corrections to these problems, right? But this is what we need. I think this is the comprehensive view we need to take about like where we are in the universe,
and
where our work kind of fits into the larger view of things.
Another thing I've been thinking about was like, people are asking for more inclusion or more ways to belong and to be included in the process. But another distinction I think we need to make is they're also asking to not be, alienated or like cast outside the margins, right? Something I heard from an advocacy stakeholder was that the way our structures are, we have the mechanisms to exclude people. So people who are part of who are racially marginalized or marginalized by class, we have the mechanisms that can exclude them, right? To say like, it was specifically with housing. So if somebody has a neighbor that they don't want to live next to, then we have the mechanisms to complain, like this person is not a good tenant, but really they don't fit in the demographic that I want. And so like, we both need to create resources and address these problems of exclusion, right?
Yeah, and maybe the answer isn't to remove the mechanisms for exclusion as much as creating more mechanisms for inclusion, especially by marginalized people who are the most likely to be excluded in our community. In my outreach, the underlying problems and causes, I have more here. This is ones that I actually found from the outreach, is that the current city services seem to be very much reactive and rather than proactive when it comes to public safety. So like the things that we're talking about, mental illness, they only seem to address the safety needs when they're at a crisis level, especially marginalized people's needs. I also found that the stakeholders, especially community and operational stakeholders, perceive these problems as either A, too expensive, or B, too difficult or intractable or wicked problems or whatever you want to call them. But however, our research that we did shows that it actually saves money to directly fund human safety needs rather than waiting for them to become crisis situations and then pay for ambulances, emergency room visits, arresting, incarcerating, prosecuting, and and more. And so that question then to me is, okay, how can our special committee and the CAPS Commission change these perceptions in our community if they are false perceptions, which based on our research, those are false perceptions that these problems are too expensive or too difficult.
And listen, some of the interviews that I listened or I read the transcript that you did, usually I think that was especially poignant when you asked, is this perception or is this the reality? And I heard from people who lived experiences that the perception is wrong. So that's one thing that we can address.
Yeah, and I found in my outreach at the homeless shelters, people were telling me the stories of how they became homeless, and every one of them, like, none of them had the kind of stories that you expect to see. I mean, that you would think like, oh, maybe their mother was homeless and they just like that's all they knew how to live, right? This is like the perception, like, oh, because even some of the stakeholders said this, that, oh, there's so many homeless people who don't even know how to live in it. But no one said that with actual marginalized people I spoke with, they all said, oh, well, what happened was I got a felony and then I couldn't get an apartment anymore because they did background checks, or I had an eviction and then I couldn't get an apartment anymore because they do background checks, or like not small, but I mean, really kind of things that are easily fixable, especially if there was, if our community in the city itself took a proactive approach to actually preventing the causes of crime and violence, rather than simply reacting and then punishing and incarcerating the people who commit crime,
Yeah, and I think that energy is already present with the criminal justice reform stuff that's happening, to prevent that. so we don't have these added costs as a community.
And I think the same goes for drug addiction. I'm not an expert in drug addiction, and mental illness, but I think they are also examples of problems that simply spiral until people get to a crisis situation, and then it may seem intractable, right? I mean, if you have a mental illness that's not, a mental illness need that's not addressed for several years until you become violent to someone, well, yeah, at that point, it may be really problematic and hard to solve. But if you had your needs or drug treatment, if you were able to have affordable and safe drug treatment at a earlier stage in your drug use, I'm sure that would be a lot more effective than waiting until someone's arrested multiple times and or lose their children because of it, you know? And then as far as more structural things I noticed in my outreach, the crisis response that is currently provided is unpredictable for the callers. So it's unpredictable, so people don't trust the system because the dispatch, first of all, the dispatch protocols don't have public oversight. So actually, we don't know what they are. And in fact, one of the major operational stakeholders we talked to, who is one of the crisis response providers, they don't know what the protocols are. They just get the calls that come to them. And so if we don't know what that is, and if the operational providers don't know what the protocols is, well, certainly marginalized people who need help, they don't know what the protocol is. So they're afraid to call in because they may get armed police, or they may get the police social worker, or they may get a fire department, or they may get the fire social worker, but they can't take the risk because they don't know who's going to show up, and they don't have any control over that.
And that sort of confirms, at least with my initial research with Denver Star, that sentiment was the same there. Something else.
I interviewed a woman at Community Kitchen, and she told me, like, she was in a domestic abuse situation, and she felt like it was impossible for her to ever call the police when she felt unsafe because her husband is Black and he has an arrest record. And she said that in her experience, when the armed police show up to even respond to, apparently, like, they showed up one time because her and her husband were like arguing in public, and someone called the police, and that when the police ran, because the first thing they do is run their name through their system, and when they ran their name through the system and saw their felony whatever background, the first thing they did, she said, all the officers put their hands on their guns and, like, called in backup or whatnot, and that certainly made everyone, she said, it made her feel less safe. And it made her husband feel less safe, which probably in turn also did make her less safe. So, and so it wasn't, to me, it's not just an unwarranted fear. It seemed very warranted that they're afraid to call the police.
Yeah.
Mm-hmm. And then, so that's about, oh, and yeah, I mean, I think we already talked about this a little, but I think that one of the structural things I noticed is that the operational stakeholders, not so much the people on the front line of the operational outreach, but sort of more the people sitting in the offices, making the decisions, seem to be focused more on protecting the rest of the city population from potential threats posed by the existence of marginalized people. And, kind of trying to focus on, well, how can we deter marginalized people from moving here? Or how can we make the city just so unattractive they don't want to be here? Or, protecting the rest of the city from marginalized people, rather than, which I think is our approach, which is a scientific evidence-based harm reduction approach, which is to focus on protecting the safety of marginalized people first.
Yeah.
And then that in turn makes everyone safer structurally.
And I found that advocates and stakeholders had that approach, but it was the other community, political, operational. Well, operational were pretty good, like to talk about what contrasted or what was surprising. I think that the operational stakeholders had a lot of good ideas,
Mhm.
not that they're perfect, but those kinds of things that are evidence based, it seems like it's kind of political and operational, that those could be most successful in implementing more.
And there definitely is a wide range of the operational stakeholder outreach, in my experience, especially between people who are on the front lines, solving these problems, and people who are, possibly in the back office, managing the office. And I also found a structural cause that seems in common is that the current services that are being provided seem to be by people without lived experience in these particular areas. So maybe they have lived experience in other areas, that they're working in, but particularly these three problems, like homelessness, drug use, and mental illness, it doesn't seem from our outreach, the people that I noticed who are currently providing the services, even in advocate situations, in a lot of the situations, are being done in very, educated, smart, well-intentioned ways by people without lived experience. And I think lived experience is something that is really valuable to solving these problems. And I mean, and I also think that not having lived experience makes people more likely to misperceive the structural causes of these problems. Because I know, like if I hadn't have been homeless before, I think I would probably have a much different approach to what I see as the causes of homelessness. For instance, I think having lived experience is just really priceless. And then, basically just that the marginalized people very much were afraid to ask for help, especially because law enforcement, our whole 911 dispatch is really decided by law enforcement who's going to respond. And law enforcement's most structural incentives are to make arrests, find drugs, and enforce law, not to provide direct help for people. Unfortunately, that's what their structural incentives are. And marginalized people know that. The people I talked to said, they just some of them said, if drugs aren't involved, they don't even call the cops because they said they don't think they'll respond if they don't think that there's drugs there. Like that's they could tell that's one of the structural incentives, So yeah. And so how do these confirm or contrast our initial findings? What was surprising? How's Bloomington unique?
Well, so we already spoke about a little bit.
Yeah.
Like, it confirmed that there's a disconnect between what best practices show that would be helpful, what advocates know or are saying that they're trying to implement, they've seen works, and what the community thinks would actually work or thinks the problem is. So like as you spoke to, like sometimes people in the offices think that the problem is something, and so they think it's something that's is not actually the structural problem they're going to be addressing.
Like a lack of resources.
Right. So.
Yeah, I found it confirmed our findings that community safety should be community led and human needs focused. rather than focused on law enforcement, which was the main theme of our presentation in our town hall.
But like, there were even stakeholders that, when I asked, the first question, like, what's the major threat to public safety? There were people who brought up environmental concerns like groundwater. And like, that's not something law enforcement can address.
Right. Well, so much of community safety is simply, outside of what law enforcement should be expected to address, And that was another thing. I mean, it seems like our community, our law enforcement agency is probably doing a lot more than a lot of other law enforcement agencies do to address these problems in a systemic way, by hiring social workers, and, by not, maybe not prosecuting people who just have needle possession, things like that. I think our community does a lot. But to me, the reason it keeps getting worse is because, that simply law enforcement is not a tool to solve this problem. Because this isn't a law enforcement problem. The problem isn't caused by people not following the law. You don't become homeless because you broke the law.
Right.
I mean, maybe you do, but if so, then that's a structural problem.
And the other thing to remember is that laws are also superficial. We create the laws to try to address these things, and then we enforce the laws thinking that enforcing the law is what will address it. But what we're suggesting, what we're talking about here, we're trying to do again and again, is we need to address the problem so that laws aren't needed to attend to the problem.
And I found in my outreach with marginalized people, that whenever I ask them, what their thoughts are on an unarmed, highly trained peer response task force, that was very popular, especially with the direct line to call them. And I would even go so far as to say that without the direct line, I don't think it would be popular. Simply because of that trust issue. I found a bit of a contradiction in talking with some of the operational stakeholders, especially city, who, people who are currently making these decisions. Like you said, they continually would say, well, this isn't our problem. Public health is the county's problem, or homelessness is, it's caused by federal and state, mechanisms and that, but it's contradictory because at the same time, all of these same people in these same departments also told me what their departments are actively doing to try to help solve these problems. So it seems that operational stakeholders already view these problems as within the purview of the city's work, but they do lack the structural incentive for resolving them because they don't see them as their responsibility to resolve. Okay, we're getting short on time. Oh, I thought that some of the ways we're unique is that Bloomington has a lot of resources, especially with the university here, but also just with our nonprofits and like CJAM is a wonderful resource. Our community has a lot of resources that I think a lot of communities don't have. And we also have the highest rate of inequality, which is something we mentioned in our town hall. And I think that is one of the underlying, structural mechanisms behind all of these problems, which is also highly correlated with high rates of crime and violence. So yeah, I think inequality is one of the ways that we're unique, and having resources is also one of the ways we're unique. So hopefully we can put those together somehow and use those resources to reduce that inequality. I think also heading home is one thing in my outreach is, they're really doing a good job as far as trying to resolve homelessness in an evidence-based structural way. Because it's a nonprofit, it does have those problems that I mentioned before, where it's not accountable to the community like the city government would be. And it does, I think, lack the long-term funding commitments to have those long-term strategies. But it certainly is going about it in the best way that they can. And, oh, I think the problem, one of the problems that seems to underlie a lot of this is the community democratic participation, especially by marginalized people in decision-making processes that would need to be addressed in whatever recommendations we have, because whatever recommendations we have, in order for them to be sustainable, they're going to need to have oversight, not just like public and community oversight, but by the most marginalized people. So I think we need to really work on focusing on that, on community democracy.
In a substantive way as well, because
Yeah.
I distinctly remember one of my interviews with somebody with lived experience who said that they had previously been in a situation like that where they were on a commission or a committee and they were included, and so they felt like it was actually addressing things. So I think that's hope, what we need more of that.
Yeah, and hopefully, whatever programmatic recommendations we may have, as far as, alternative public safety and crisis response, I think that hopefully our commission can find a way to match the structural incentives for sustainably resolving these problems with the resources and capacity for doing so in one organization, right? Rather than it all being scattered all over the place and frankly not having the incentives for resolving it sustainably because they're not being held accountable to the most marginalized people in our community. So anything to add before we turn, Liz, to housekeeping things, timelines?
Well, the only thing I would say in listening to you, I think that I keep, I think the points that you were talking about in terms of having a response to crisis and to issues in the community, it sounds like there was lots of feedback from underrepresented folks themselves of feeling like, they're hesitant to call for help when they need help dealing with things. I think a lot of the providers and advocates that work with underrepresented folks were identifying that, at least in the town hall meeting, and that there needed to be a different response to those kind of crises. And that seemed to emerge pretty strongly from what you were just sharing and what I heard at the meeting. So, yeah.
Okay, so finalizing timelines, process, deciding who does what. How can we get our report and recommendations ready by June 1st or sooner? How can we be sure to include Cammie in this process? Okay, so
Can I ask a question?
Yeah.
When do you have to have recommendations into, I don't know, is it to the mayor's office and then the mayor's office presents it to the city council, or what is the actual process that you all need to go through to make these recommendations?
Well, as I understand it, the process is that our special committee is going to we're going to create a report and recommendations. And then we're going to do this hopefully by June 1st. And then we're going to share that with the rest of the CAPS commission. And then hopefully we can do it by email before the meeting. And then we can actually discuss the report and recommendations in the next CAPS meeting, which is June 1st. So that's sort of like the first reading. And then hopefully, but this isn't set in stone, then we could vote on the report and recommendations in the July meeting. And the only thing that really is like the set in stone hard deadline is to get our recommendations in before the city council passes its budget.
No.
Because our recommendations will likely include, things that need funded by the city council.
So to answer your question, it would be, we'd be giving the recommendations to the city council.
Oh, yeah, we would present, and then, like last year, we and Jason, but probably just, one or two people from our commission will give a presentation, like, at the city budget presentations. Have you ever attended those? Yeah.
Yeah. When
It's
are
like-
those?
it's Commissions, it's for the commissions, obviously, we're not a city department, so the commissions give presentations. They're in July and August.
Yeah,
I think last year's ours was in August, wasn't it?
July
Oh,
20th,
July, okay.
when
Um,
I look back. at
yeah,
the-
and again, I don't know if it's a hard deadline, I mean, you don't even necessarily have to give them a presentation. We just offered, I think, and I know not all commissions make presentations, not all commissions even make reports, that's not even required. But it's something we certainly plan to do.
So, and then it like recommendations for funding happen
Yeah,
at
so
that
our
meeting. And
There'll be
then,
recommendations to both the mayor's office and the city council. Our commission we can advise the mayor, the city council, and any other city department. We can make recommendations for them. And so I'm imagining our recommendations will be for both of those main bodies, at least, for the city council and mayor, at least.
and so do you feel like by June 1st, you'll have those recommendations? So then part of what the process that you're talking about will be to have these meetings with these individual bodies to share the results, to share the report, and begin talking about next steps? Or is it just between June 1st when you make the recommendations and then the next thing is going before the city council?
Well, another stage I didn't mention is between June 1st and the July meeting is getting endorsements. I think we'd like to get, because we did so much outreach with so many community organizations and important stakeholders, that I think it could be really valuable for us, especially once the commission has weighed in.
Yeah.
Then to go back to the stakeholders and try to get official endorsements before we make recommendations to the city.
So we can,
So sorry, I forgot your question. I answered.
Well,
your
I guess
question.
I just wondered if you needed, if in terms of, you had talked about sort of the process steps,
Mhm.
whether you wanted to have opportunities to share these ideas with the mayor's office and the city council before August, when they're getting ready to make their decisions, and they're going to be hearing a lot of presentations. So I just didn't know if part of the process was to say, here's what we're going to be asking for. This is our recommendation. We'd like to request X amount, and have those conversations before August when you make this presentation formally.
I'm not sure if that's an option open to us, but we can ask Ash. I think that's a great idea.
Well, yeah, I just don't know how it works. So, yeah.
Mhm. Yeah, well, we didn't make any substantive recommendations last year, so especially none that required a budget, so I'm not sure if that's an option. I do know that the city tends to prefer the commissions and boards to have more, not totally like one-way communication, but to have more, of the grassroots advisory sort of role, rather than like constantly going back and forth, both because, of the limited resources the city has, but also I think in order to encourage that democratic process. So, but I will ask Ash, I think that's a great idea. It'd be great to get some feedback before making the final recommendations from the city. I mean, certainly we did outreach already, with lots of city stakeholders, but it would be nice to, get their official feedback on our recommendations as well. Good idea. Oh, okay, so our report should cover the background, the process, research, outreach, and findings. Also, I think it should include, and that would be mostly like text, long text, maybe a couple of images. And I think some impactful or representative direct quotes from our outreach would be useful. And then we need to follow up with those stakeholders and make sure it's okay to use those quotes. But, oh, do you think it would be good? I mean, do you think that it's not a violation of their privacy to list the names of the organizations we did outreach with? Because we already said we're not gonna share who said what, and we're only gonna share the type of stakeholders. But like one list of all the departments and or organizations or people that we did outreach with. What do you think about that? Because I feel like we did so much, and if we don't share that, like it's not going to come through that we did outreach with all the organizations and people, you know?
Yeah. Well, I guess if you're gonna, maybe I don't know what you said to folks when you were talking with them. So you could just really quickly send them an email to say, hey, we're getting ready to do our report. We'd like to list that, the organizations that we talk to. I would be careful about listing individuals because that might, unless you got permission. So you need to be very clear in your email back. Are you okay if we list you as someone who was interviewed and your organization? And, I mean, a lot of times you'll see that listed who was interviewed.
The only individuals we did outreach with were mayoral candidates.
What?
The only individuals we did outreach with were mayoral candidates. The rest are all organizational.
And the community member, I thought we wouldn't say. Well, I reached out to the community.
Well, yeah, we also got feedback from the community at our town hall, and we got outreach, we did outreach with marginalized people, but I didn't write their names down or anything.
Yeah. Well, I would just ask the organizations just to be on the safe side, so you don't, in case their impression was something different, they may not have understood, what you were saying. So I would just double check.
Yeah. And we could do when we reach out for endorsements, we could say, can we also list you as somebody who gave feedback while not attributing your name to the specific feedback you gave?
Yeah, I mean, hopefully we can hear back from everyone, we could do that.
And what you can describe is that you had, you could say, we had, if you don't hear back from people in a timely fashion for you to get your report done by June 1st, you could say, we interviewed a wide variety of, city departments, you could sort of nonprofit social service providers, you could describe the stakeholder groups. If you were concerned. And it may be that Ash has some good feedback for you too on,
What we actually had introductory remarks that we read to everyone that just basically said, we're not going to use anything that they say without their explicit permission. And if we do use anything they say, we won't attribute it to a person or an organization, but rather to the type of stakeholder that they represent. So we didn't say anything about listing who we talked to, but I agree it's better to get consent.
Yeah. And I wasn't suggesting you needed, I thought you wanted to maybe list the individuals that you talked to. So that definitely.
I was just thinking even
the organizations.
Yeah, just to say, like, we talked to all these organizations and departments, but I agree, it's better to ask first. So, okay, then, So as far as writing the report, and I guess the recommendations will be a part of the report. So how do we want to divvy that up? Yeah, and how, I guess before we get to that, how can we include Cami in this process?
I think specifically with including Cammy, we should ask what she feels she's able to do. And then kind of work around that, because I think you and I are more flexible, but I know Kimmy's dealing with some things. So to see what she wants to do, and then we can negotiate how to.
Yeah, I mean, I know for ODL, like, we need to have her in a meeting if we're gonna make substantive decisions, is what I'm saying. And I know, I think at this point, she's gonna be able to do stuff on Zoom, but I think she said she just didn't have her computer set up yet, because she just got back from the hospital, so I think she said that she thought in a few days she'd be able to attend meetings again on Zoom.
Okay.
So hopefully that means we can have at least 1 or 2 more meetings, you know, to really finalize and wrap up those recommendations. So as far as that goes, as far as background, process, research, and general like findings from those, I kind of already took a stab at those a while back before, you know, we started the outreach. And so I'm happy to kind of, you know, incorporate our outreach into that. So that basically, and then obviously, you know, bring it back to you and Cami for your input.
Yeah.
And then that basically leaves covering our outreach and recommendations. And of course, the pull quotes and like the overall formatting of it.
I can definitely handle the labor format.
Okay,
In terms of full quotes, did you want to? Because as I was conducting the interviews, I was thinking, oh, in almost every interview, like this would make a good full quote, but
Okay.
like, do we want a range of representative quotes?
I think so. Yeah, I mean, I guess we want a mix of impact and representation, right?
Yeah.
And then do we want to have any quantitative data in here?
That would be helpful. Right.
Because we have a survey from the event. And then, of course, with our outreach, we actually did transform those into quantitative data with those forms.
And I think that would be compelling to have both like the qualitative sentiments and the quantitative.
Like this percentage of people said homelessness is a major problem.
Right.
Yeah. Okay.
I also too, if you would like me to review the, you know, the finding the themes that you're going to articulate, because you want to be sure that you're articulating what you heard, not how you interpreted what you heard, but sort of what was heard. And you want to be sure too that you're capturing differences of a, you know, if you heard things that were an alternative to what it might be that you're recommending, you want to be sure for validity's sake and for people spending time, you know, and to ensure that people really were heard, that were giving their opinions, to be sure that you present, you know, a well-rounded summary of the themes. And I'd be happy to look at anything if you'd like, you know, that piece, and I'd be happy to just give some recommendations if that's allowed.
Yeah, that would be really helpful. That'd be very helpful. And you know, now that I think of it, our report could also have an appendix where we include the actual like photographs of those the flip charts from the public town hall.
Sure.
You know, because I have pictures of those. And I have handwritten notes from when I went into the homeless shelters and got quotes from them. So maybe some of the actual direct information could be included
Well, like your
well,
list of
pathways.
questions and yeah. But-
Yeah,
Well, I would be happy to take a look at it if you'd like me to do that. So I'll just
For
let
sure.
you guys send it to me when you're ready. So,
Okay, yeah, well, we've got some work to do, but I think I'm ready to do it anyway,
Yeah,
so. And hopefully we've got some time in
yeah.
the next week to work on it. Great.
okay. Well, thank you for your service and thank you for inviting me, and I will talk to you all later.
Okay, bye.